Hi, it's Mike here from TwoDads. Today, one of the things that I wanted to talk about specifically was fertility treatment and how those are affected by it currently with COVID-19. And I'm thrilled today to be joined by Francesca Steyn from CRGH in London. So I'd just like to bring Francesca on. How you doing, Fran?
Hello, I'm good, thank you.
I think what will be really important for people today is I've got a number of questions which I think are really pertinent to people that are trying to conceive at the moment, people that may already be in a treatment cycle, or people from the industry generally that might just want some additional guidance. Talk to us firstly about you and your role at CRGH. What do you do for them?
Well, so currently I am the lead nurse at CRGH and I'm in charge of all of the quality and compliance, so all of the important stuff that keeps us in line with the law and everything like that. And then I also manage the surrogacy program and the egg donation.
Amazing. Thank you. Thanks for joining us this morning as well. Really appreciate it. Thank you. Okay, so what has the last 3 weeks been like for the clinic and the industry generally?
It's been really tricky, actually. It's been really worrying with, for staff and patients, but for all of us, for the whole fertility industry, not just in the UK, globally, it's been really quite tough because it started off where we weren't sure what we could do, where was the guidance. And, we still have patients that need us and need the support and are in treatment. So it was really tough.
I can imagine. And you're a reasonably sized clinic as well. So I should imagine in terms of the workload to halt treatment, that in itself must have been a challenge.
Yeah, really it was. Because we just had to start working it down and doing what we could to support the patients who were in treatment. And there were some tough decisions. I mean, we had to tell patients that were potentially going to have a fresh embryo transfer that they couldn't. So they had to have their embryos frozen. So it is tricky, and then postponing treatments and things like that. It's a huge workload, but the whole team had to come together. Every member of the team had to work together to get us through the past few weeks and beyond, really.
Yeah. And what you touched on the mood of the patients. What's that been like? 'Cause I can only imagine how traumatic it must be for some of them. What's it been like? What have patients' reactions been? Have they been understanding?
They're really understanding. Yeah, the patients have been great, but however, they're already really anxious and already quite vulnerable because they've already been on a journey to get to the point of having fertility treatment, whether it be as a single person, for surrogacy, any type of treatment. They've already been on that journey to get and a little bit of anxiety to get there, and then we're having to say we're not sure it's safe that you continue at this time. So they're distraught and they're needing support, and then the patients that have had treatment are pregnant are also anxious and worried. So they've been really understanding. They've been fantastic, but they understandably are really upset and and worried.
And I should imagine for a number of patients that have already been on a huge journey, to then have something out of their control halt their treatment that maybe on several attempts later and maybe on their last embryo even, and then for that to stop, it must be really frustrating and frustrating for you guys because you want the outcome that they all want.
Yeah, it is. I mean, to watch someone, and to make that call to someone to say to them, we're going to have to stop, we can't continue at this time, is awful. You're pretty much breaking all their hopes and dreams in one telephone call, and we know it's not, it's out of our hands. We can't, we've got to do it, but it's hard to do that to someone, and actually it takes its toll on us as well. I don't want to be ringing those people and telling them they can't have their treatment. It's really upsetting.
Yeah, no, I can imagine. So what's the current, for anyone that's watching that's in treatment or is considering treatment this year, what's the current guidance from the HFEA?
So we've been told by the HFEA to cease all activity really by the 15th of April. So most clinics are doing that and they're following the guidance. There are still some clinics that are operating, but it's for crucial things like fertility preservation for oncology patients. They can't be delayed, they can't wait. They've got to get on with the chemotherapy and things like that. So there are some clinics that are still operating those cycles at the moment. But the guidance really is that we need to cease all treatments by the 15th of April. And then will be further issued guidance along with what's going on with the government. So once they probably release something about, when lockdown is, if it's going to be extended or anything like that, then I'm sure that's when the HFEA will step in and say, look, we're revising our guidance too.
And I'm guessing it's the million-dollar question. You have no idea when that's going to change, So, and the clinic will continue in operation for those patients that are pregnant that need your support, I'm assuming.
Yeah, so we're still open. So there's a lot of the staff have been furloughed because it's something we've had to do. And there's a few core people that are still working to support the patients that are finishing off their treatment. So the ones that are pregnant, anyone that needs medication, anyone that needs advice and support. So we're still there for those patients. And will be until we reopen again. So we're still able to do that. And we've got nursing staff, lab staff, admin support, counsellors and consultants. Everyone's available so that if someone needs any of us, we're there.
Okay, perfect. And then I guess a question that has just come to me in terms of how this differs to our colleagues over in Europe or are taking advice from ESHRE. Is the advice similar?
It is similar, although there was a press release from ESHRE on the 2nd of April, which said that actually there was, the risk in pregnancy for the virus is minimal, pretty much. It's not, they're not worried about it. That's what the press release. That's how I read it anyway. That people that were trying to conceive. And with the virus going on as it is, there wasn't that much of a risk. There's some studies to show that there was, mothers that were giving birth who were affected were having healthy children who were not affected by the virus. So That was in the statement also, which is good news. There's going to be further work looked into it, but that was the press release on the 2nd, which came out and said, pretty much that there's not so much a risk. But obviously, I think it's more to do with, about, the social distancing and thing, having so many people in one place, in clinics and things like that. We just need to avoid it.
Yeah, it's just impossible in a clinic setting. Just, most clinics have a reasonably tight on space, so to have social distancing in that environment is just impossible. And there's a couple of questions that have come through, which we'll come to in a moment. But so before we close and come to questions, what are you advising new patients then? So as you obviously know, people might be watching, CRGH is a clinic partner to TwoDads. We forward a number of patients that are either in treatment, had treatment, or pending treatment. What's your advice to anyone that's watching this that is probably considering starting their surrogacy journey? And it's just all up in the air. What's the official line from CRGH?
Well, so we're still very much open and supporting patients. We can't actually physically start anything yet, but we can advise on all of the things that we need to in order to get you ready for a treatment cycle. Our doctors are doing video consults from home, so you can still have your consultation with the consultant.
Amazing.
The nurses who are we're still doing nurse consultations via video. We're around. We can get you started on the journey. We are operating a waiting list, so because we had to delay people, so there's patients on that list. I say it's a waiting list, but it's more like a postponed treatment list. So as soon as we're allowed to say yes, we can open, we can start treating. So
and I'm sure you'll be inundated when that happens.
There's 300 patients on that list.
Oh my goodness! See that's just from your clinic.
Yeah. But also we've had we've had people that have rung, who are thinking about starting and haven't got around to doing it yet, and actually saying, you know, now we've got time, we've got downtime, we've been chatting about it, we've been looking at our options, so we want to book an appointment. So those are being added to the list also.
Wow, I guess there's so much you just don't think about. You know, when you sit in your own little bubble thinking, oh, when am I going to go back to work? And then you think of all these hundreds of thousands of people that are just itching to get started with their treatment or to finish their treatment even. Well, there's a question that's come through. Now, I believe this is more related to pregnant surrogates. So again, your advice from a clinical point of view might be advised, and I can certainly chip in with what we've helped intended parents with. So the question is, what about existing pregnant surrogates? Can they still give birth in hospitals? From my point of view, that is still happening. Now, what is happening is it's a one birthing partner rule from what we're seeing. We helped a couple at the weekend, in fact. And so usually that person is the surrogate's partner if they have one. So, and this is pregnancy generally in the NHS at the moment. So a lot of new parents are missing the birth of their child because of this. And that's unavoidable, unfortunately. What we're seeing is that some trusts are being amazing and really accommodating to intended parents by still allowing them to have their safe space and their room on a ward that they can bond with their child. So we are seeing some positives. Are you hearing anything?
Not really. So with regards to having, you know, someone in the room, I've heard that but all practices are really doing that. I think even our clinic, you know, we're having to ask people not to have a partner or something in the room unless it's a pregnancy scan, and then it's just one, because we're trying to put the social distancing measures in place. So so that is what I've been hearing. There's not I don't think there's no reason to have any restrictions further than that in place, you know, for people who are healthy and pregnant, and, you know, they can still go into hospital and give birth. I mean, everyone else is doing it, so there's no reason why surrogates shouldn't be able to. So
no, I think it's the social distancing rule, I believe, is the issue. A comment's just come through from Victoria. I believe Victoria is either a community midwife or the health visitor. I can't remember. She follows TwoDads. She's commented, we've seen a huge rise in home births in Lincolnshire, which would make sense, I guess. Be interesting to understand if any of those have been surrogacy related. But yeah, totally understand that. Okay. Is there anything else that you want to add, Fran, from a CRGH or from a fertility nursing point of view?
I just think, I mean, there's nothing we can do. You know, the government advised that we've all got to stay at home and stay safe. And, you know, I think what maybe some good advice is, you know, fertility treatment is stressful. It's crazy. It takes over your life. Maybe use this downtime to, you know, do things that you enjoy, you know, and take some time for yourself to chill out, relax as much as you can. Spend some time with, you know, close family, no one outside. You've got social distancing and all that, but, you know, use this time well to get yourself, you know, ready and prepared. You know, if you're waiting for your surrogate to start, make sure she's taking a folic acid, you know, things like that, just, you know, so that you've got this headspace now, because when it comes, it will be busy and it will be crazy and it takes over.
And I think it's a really good point, because you will be there for everyone when it's about to start again. And knowing CRGH as we do, you will battle through and crack on with getting everybody the treatment plan that they all deserve. So on behalf of not only intended parents, the surrogacy community, but everyone trying to conceive that's probably been watching this and has taken some comfort, thank you so much for giving me 15 minutes of your morning. I know you're super busy. Thanks ever so much. Thank you. Cheers. Take care. Bye-bye.
Bye.
Amazing. So massive thanks to Fran and to CRGH for allowing that to happen. But I'm sure you'll take some comfort in that. I definitely think that the audience that are going to be listening that will fully understand and appreciate some of that said we'll certainly take some comfort from that. So these little episodes are going to be something regular over the next 2 weeks, talking to other healthcare professionals from the industry and generally related to the trying to conceive community as well. But I definitely wanted to kick it off with a real special one with someone who we hold super dear to us, which is Fran, and to all of the team at CRGH. So thanks ever so much, everybody, and thank you for watching. Thank you. Bye-bye now.